All right, we are with our furry friends here today because it's time to talk about medical issues that face our canine family members that are similar or just the same as we see in humans and adults and children. So Dr. Tomeshia Hubbard is with the Alabama Veterinary Allergy and Dermatology Service. She's along with our regular Dr. Jerome Williams from Red Mountain Animal Clinic. Hello to all three of you this morning.
Good morning.
Good to see you. You brought your friend with you today.
Yes, this is Nino.
And Nino has been a visitor with us from time to time. All right, we're talking about, in particular, yeast infections that happen in animals, like in their ears or on their skin.
Yes. So a lot of patients that have allergies or allergic skin disease will come down with yeast infections sometimes. So we can see those infections in their ears. We can see them on their skin. Sometimes they'll lick their paws a lot, and we will see yeast overgrowth.
So is it when they're in between the paws and then between their toes they're licking?
Yes.
Like, is that what's going on?
Yes, sometimes it's yeast, sometimes it could be an overgrowth of bacteria.
Okay.
So a lot of times we'll see both infections in combination, so bacteria and yeast.
I understand we have a picture that we can look at to go along with that. And
Yes.
so, oh, bless that little.
So that's right in between the digits,
that's
right
typical.
in between the paws. Yes, that is very typical of a yeast infection. You'll see redness, and a lot of times they will lick their feet excessively.
Okay, so what's happening? Okay, now you're looking at an ear infection.
Yes.
Unfortunately, I have seen too many of those, Dr. Williams, as you know, with my dogs in the past.
Yes.
Yes.
And one of the things that happen too, we treat a pet for a bacterial infection and it gives the yeast an opportunity to overgrow.
Exactly.
So many of the veterinarians, they treat for the other infections and ignore the yeast that overgrows.
Okay, so if a dog has the little between their paws and they're licking that, what is that doing when they're licking it if that is a problem?
So the moisture from the mouth will have a tendency to cause the skin to become warm, wet, and moist. And so the yeast and bacteria tend to overgrow in an environment like that.
So do they spread it anywhere else by licking it, or does it just make it worse where it is?
It usually just makes it worse where it is, but if they continue to lick in other areas, then they can create an infection in those areas as well.
So we may think sometimes, well, dogs just scratch sometimes, but it's really irritating them, right?
It is. And it sets off a vicious cycle. You lick because, scratch because it itches, and you do damage, and that creates a whole vicious cycle.
Okay, is it easily treated?
It is. So we can treat it with either an oral medication like an antifungal. Sometimes we can treat it with a medicated shampoo.
Okay, what are we looking at here?
So this is a dog that has pretty much a generalized yeast infection. So you can see the hair loss, you can see redness. So he's basically just going to town on himself.
That's
he's just
really
itching
bad.
and scratching. So it can become really bad and excessive. Like this pet has been chewing and licking in those inner thigh areas. And so a lot of times the yeast will overgrow as a result of that.
So unless you're looking and paying close attention to your pet, sometimes this can go on and you not know it.
Exactly. And a lot of times the yeast infections are missed, but if your veterinarian does a skin cytology where they take a sample from the skin and look at it under the microscope, they can identify the bacteria and the yeast if they are there both.
Okay, Dr. Williams, for example, when I brought Buddy in or when I used to bring Shelby in, you would have to do that, and so you would look and see what was going on?
Yes.
By just taking something from their ear?
Right. We take a swab from the ear and stain it on a slide and look at it under the microscope and identify the type of organisms that are there.
And the thing about that is it's not that expensive to treat, so you really are...
It really is not. It's not expensive at all. So if we do those samples, look at them under the microscope, then we can determine how severe the infection is, and then we'll determine whether we just need to use one medication or if we need to use a combination of medications to control it.
Okay, do you then try to figure out what is causing in the first place?
A lot of times there are underlying problems, like we talked about allergies, so food allergies, environmental allergies can contribute to it.
Right.
Sometimes they may have a flea allergy. Anything that will cause them to itch, lick, and chew can cause a secondary infection to result as a result of that.
I have told this story before because I felt like it might help people who are having similar problems. Our dog Buddy, a golden retriever, has an allergy to poultry.
Yes.
And it took Dr. Williams and us trying to put out stuff in his diet to figure it out, right?
Yes, absolutely. And food allergies are one of the more common causes, I believe. Am I right, Dr. Hubbard,
You're right.
of yeast overgrowth?
Exactly.
All right.
So sometimes we just don't know that they have an allergy.
All right, got to take care of our buddies, though. All right, thanks for being a good boy.
You know, it's been good, hasn't he?
He has been very good. All right, good to see both.